Good afternoon, everybody. Welcome again to our update on COVID-19 in Eau Claire County. We really appreciate people participate and listen to what's happening in this community so that you can share it with others. It's an important opportunity to give an update, to share what partners are doing to make sure that we are protecting people in this community and that we are flattening that curve to make sure that the disease does not hit in a way that we can't be responsive to. It's Wednesday, and we appreciate you being here today. We do have, as a special partner joining us today, someone from the jail. The Captain of Security Services, Dan Brzezina, is here. He'll be sharing a bit about what we're doing in the jail to not only protect those people that are at the jail, but also the staff that are working to make sure that people are protected in our community, and we're happy that he's here. I'll share a little bit of an update first, and then Captain Brzezina will share some things, and then we'll come back and do a closing and some questions. So in Wisconsin, we have 2,756 cases of COVID-19, positive cases by testing of COVID-19. That's an increase of 178 from yesterday. 99 deaths, an increase of 7 deaths. 30,115 negative tests. Again, testing capacity has increased in the state and more tests are being run. The state is reporting a hospitalization of 790 people over the course of their illness. About 29% of cases are reported as being hospitalized. About an equal number of males and females have been impacted with positive cases. A larger percentage of males have been hospitalized. In Eau Claire, we again have 21 confirmed cases, no increase today. Our testing numbers are at 1,047 people tested, an increase of 47 from yesterday, with 875 negative, an increase of 50 negative results received since yesterday. Again, our range of ages is wide, as is the gender distribution, similar to the state. Yesterday was the election. We've talked a lot about that over the course of the last week or so. The in-person election was held. I really want to give amazing kudos to the poll workers and to the clerks across Eau Claire County who put in countless hours to make sure that the poll sites were set up successfully and to make sure that during their operations yesterday they did everything possible to protect the public. It was an enormously important partnership. Voting is enormously important as part of our civic duty, and it really went well yesterday. Voters also had to make an enormous adjustment. We had many people in Eau Claire County absentee vote, which is really the safest way to get their votes in, and many people also had to adjust to slightly different polling sites and to a slightly different rhythm at that polling place than maybe they have been used to, and people really made that work, so thank you to everybody. The spring election results will not be available until all of the absentee ballots are received, and on Monday next week, the clerks will be following 4 o'clock starting to post those results statewide. Absentee ballots needed to be either postmarked yesterday or delivered yesterday, as we talked about. So results available after 4 o'clock on Monday, April 13th. Continue to focus on childcare for those people that need to work in our essential services. Childcare planning for those people that may have a change in their household situation because of illness or other reasons is also something that we strongly encourage. Yesterday, we spoke a little bit about mental health resources. The Resilient Wisconsin website on the COVID-19 website for the state does have many of those resources listed. We will be talking about mental health resources locally in subsequent times with you, but I do want to call out one particular one today. Eau Claire County Human Services does have an outpatient mental health clinic That outpatient clinic is open, providing telehealth services. So if people in Eau Claire County who don't have other resources and need some support for mental health and substance abuse, they should call the Eau Claire County Human Services Department at 715-839-2300. Both the outpatient clinic resources as well as other resources would be available to them at that number. We also continue to get many questions about the upcoming Easter holiday, both religious celebrations as well as family celebrations. A reminder that this Stay Safer at Home order is in place to keep our group small that we are exposing ourselves to, and that our household is those people that we live with. The state guidance is very clear. One of the questions we're getting is about drive-up communion services or drive-up services. And again, fewer than 10 people can be involved in a religious service on a site, and that includes any 10 people that are there on that site. So we are providing lots of guidance about that this week to our congregations. We know that in the end, people in Eau Claire, including the leadership of our congregations, wants to make sure that people are safe and healthy, and we are supporting them in the creative ways that they do that, using video and phone calls to support their members. Again, that guidance was sent out broadly to congregations across the county today. So today we have Captain Brzezina here. He is going to share with you some information about the jail, not only keeping his staff safe there, but also keeping those individuals that are at that jail in that congregate setting safe. And we're happy to have him join us. I'll come back for questions afterwards.
Thank you, Director, for the introduction. Good afternoon. Again, my name is Dan Brzezina. I'm the Captain of Security Services for the Eau Claire County Sheriff's Office. On behalf of Sheriff Kramer and our command staff, I've been asked to talk about our law enforcement and jail operations and highlight our planning processes related to COVID-19. Our job is to keep the community safe, and I want to assure everyone of these 2 points. As always, we are taking inmate health and safety seriously and have procedures in place to protect from spread of COVID-19 within our jail. As part of this work, we have taken some temporary action steps to reduce our jail population from 281 to 143 inmates since March 1st of 2020. I'll give some more details on these points in a minute. Second, community safety is also a top priority, and we are working diligently to keep our staff healthy so that we can maintain a full operation of the jail and our patrol services as well. Eau Claire County is a leader and nationally known for its work in collaborative practices for many years with evidence-based decision-making as our guide. Law enforcement and the jail is known for systems transparency while making changes, yet keeping our mission of community safety as our #1 priority. Although we have these best practices in place, we're being challenged in these difficult and uncertain times with COVID-19 planning. We're doing our best with the ever-changing guidelines and have utilized evidence-based practices, like we have in the past, to help keep our staff, the community, and those incarcerated as safe as possible. Our office has current policies and guidelines in place for our operations. However, we need to modify these practices to meet the COVID-19 situation. We are modifying these or implementing temporary action plans in direct collaboration with our health department. These updates include recently released CDC guidelines as an example. We are continually monitoring the situation, have a Sheriff's Office staff member as part of our incident command to ask questions, stay informed of the changing situation, and update our plans as needed. We're being asked by the community, some county board members, and advocate groups about our planning process, and to prevent misinformation and speculation, we felt it necessary to share some highlights of what we've been doing over the past 3 weeks specific to the COVID-19 planning. We want public to have fact, not fear. Some of the guidelines utilized for planning and system partners include the guidelines from the CDC for managing COVID-19 in corrections and detention facilities, the guidelines for hospitals and nursing homes, We worked directly with our EMS and our law enforcement partners with CDC guidelines. We're working with our health department to include physical reviews of our jail facility and reviews of our plans. We're working closely with our judicial system, with the judges, the district attorney, our law enforcement partners, and probation parole to determine arrest processes and help reduce our jail population when possible. Some of the action steps for our law enforcement partners were to develop procedures in managing warrants both in our county and if someone were arrested out of our county, arrest decisions and probation hold guidelines to manage jail and court traffic, yet balance community safety, our courthouse security measures and assistance of our bailiff staff to keep our courthouse safe and secure, practices related to EMS calls, yet providing quality services while reducing risk to our staff and those persons who are calling for assistance. Our Eau Claire Communications Center is asking basic screening questions to help keep our staff and community healthy. Our law enforcement is working with our health department to ensure that the governor's guidelines are followed. We do follow up on citizens' complaints about the stay safe, stay at home order, and people should use the Crime Stoppers telephone number or call the non-emergency communications center number if you feel there are violations. We have suspended our fingerprint and DNA collections located in the courthouse. And more specifically, some of the things and action steps we've taken in preparation in our jail facility. We have a phased action plan based on CDC guidelines and our health department's direction. Part of those, or portions of those plans, for example, is our proper practices to medically isolate per CDC guidelines for all new arrests, and if we experience COVID-19 in our general population. We've implemented a screening of all arrestees and pre-booking of the jail to include questionnaires and a temperature check. We have furloughed all of our working Hubers who are in good standing. Those furloughed are required to follow all their sentence guidelines and face additional charges of Huber revocation if they fail to follow those rules of the temporary release privileges. This keeps the Hubers employed, yet reduces the risk to our facility. We've reviewed all bonds or conditions holding someone in jail and modified if appropriate for release. We've conducted video court when possible, reduced inmate transport substantially. We've implemented additional cleaning in our facility to include guidelines on how to clean a space if we have a suspected COVID-19 case. We provided daily cleaning materials to those incarcerated. We have posted messages throughout our building to include inmate areas on proper hygiene practices. We're providing free hand soap to all of our inmates during this time. We've communicated with our food service and our medical services providers so they can take action steps to reduce those risks in their areas. We've been planning our staffing to prepare for today's needs and the potential future needs over the next few months. We've temporarily suspended group programs and non-essential visitors to our jail lobby to include on-site visitation and volunteers. As a result, we've added one free weekly off-site video visit for family and friends. Those in jail continue to have access to television, our newspaper, mail, email, and commissary services. We are committed to continuing our mental health and medical services during these times. Per health department guidelines, all of our staff are asked to self-monitor, stay safe, stay at home and off duty, and do not report to work without clearance if they are experiencing COVID-19 symptoms. If we have an inmate being released who is showing signs or tested positive for COVID-19, we have a procedure in place to work directly with our health department and those notifications in place. To date, we have had 0 cases that fit this criteria. The stay safe, stay at home social distancing is being practiced in our jail to the best of our ability. Although one could argue these look differently to those in the general public versus in jail, these comments are not meant to be disparaging, but meant to be comparative, meaning we are practicing the same guidelines as we are not mixing inmates together outside of their living locations when possible. We're restricting group activities, we're isolating new arrivals for 14 days, and asking for good hygiene usage. Jails are an essential function and will remain open, yet follow best practices, as we have always done, and run a quality facility. The above temporary action steps have assisted in reducing our jail population from 281 inmates to 143 today, or about a 49% reduction since March 1st. We have reduced our average weekly bookings from 92 to this last week of 10, so about an 89% reduction in our intakes in our facility since March 1st of 2020. Again, these are temporary measures that are being done to stay compliant with the recommended CDC guidelines. I'd like to recognize the Health Department, Director and her staff, the judicial system for assistance during these particularly difficult times. I want to thank the inmate population for assisting with cleaning, understanding of these temporary practices in our facility, and of their families during this time. I want to thank the public for your understanding and cooperation as we navigate this process together. Thank all the essential staff for your dedication to this difficult work. And most importantly, thank you to our staff, both county and contracted services, for their dedication as we will find our way through this ever turbulent time by working together as a team. In conclusion, we want to ensure the public that we are working diligently on COVID-19, best practices in collaboration with our systems partners. Again, I want to reiterate, our job is to keep the community safe. I want to ensure every one of these 2 points. As always, we are taking inmate health and safety seriously and have procedures in place to protect them from COVID-19 within our jail. As part of this work, we have taken some temporary action steps to reduce our population from 281 to 143 since March 1st of this year. Secondly, the community safety is also a top priority, and we're working diligently to keep our staff healthy so that we can maintain full operations of jail and patrol functions. We want to encourage you that if you need our services, we will be there for you, but ask you to help us do this very critical work. You can help us by everyone following the stay safe, stay at home guidelines. Practice social distancing when in public. Stay informed and follow the health department's briefings and guidelines like this today. If there are any questions, we encourage you to call the health department number. Again, that's 715-831-7425, and get the correct information. Thank you for your time today, and please stay healthy. And I'll turn this back over to the director.
Thanks, Captain Brzezina. It's a complicated system at the jail. They have healthcare and food service and mental health work that they do, as well as working with incarcerated individuals. Very complex, and they've worked hard to figure out how to best make things work there. So I appreciate Captain Brzezina sharing, and it's helpful as we think broadly about how we make sure disease is not spread, to think about all of our population. So in closing today, the stay-at-home order, safer-at-home order remains in effect. We know that people staying at home is the best thing for us to stop the spread of disease. We do encourage people to go to the EC Health Department, the coronavirus.echhealthdepartment.org website. All of the updated information is there. Again, as Dan shared, the call center number is 715-831-7425. This is hard. Find something today that will give you a personal boost. Do something to make yourself feel better today if you can. That is an important part of how we make it through this difficult time. And we'll open it up for questions now. Yes. So the question really is around the Safer at Home order, which ends at the end of April in a couple of weeks, and Minnesota making the recent decision to extend their Safer at Home order. The state is looking carefully at what's happening with cases and spread of disease, and at this point we have not gotten an indication that it will be extended, but we do know they're looking at those dates as they are across the country. The flattening out of the number of disease cases and deaths is certainly an important part of what all of us are watching. And we're only a couple of weeks in, so the next 2 weeks will be very important. Yes. Yeah.
There were a couple questions being asked. Go ahead. There are not. The question was, is there any COVID-19 cases currently in the Eau Claire County Jail? And the answer is no. Yeah, the question was, you've reduced your jail population. What's that population that you reduced, and where are they? Am I asking? That's okay. Part of that is our Huber population. Roughly 38 Hubers were released. Our partners with probation pool went through all of their folks that are currently inside of our facility, potentially looking at people that were sitting on revocation. They may be going through that process, but at home versus in our jail, for example. We're looked at all of the cash bonds, all the other reasons like child support, for example, and those folks were looked at again and released from our facility. So those are specific ways that we were able to reduce that population. Currently, we're sitting at reduction mostly out of our secure facility versus our Huber facility. Yeah, currently the question is inmates when they come into our facility are isolated. Are there any other reasons why the current population would be isolated? That certainly is in our plan. Right now, any new intake is isolated from our general population. That's what we mean for the recommended 14 days to make sure that our population that currently is in our general general population housing units aren't exposed to risk of COVID-19. Currently, we have no one in our facility that has signs or symptoms of COVID-19. However, if those folks in our general population were to experience that or we have a positive test, we do have plans in place to take care of those isolative measures as well. You're welcome. Any other questions specific to jail operations or patrol? I'm not seeing any.
Are there any other questions? Yes.
Obviously you had some details yesterday. Even with all the measures that were put in place to make sure voters are safe at home, is there still any concern for potential, like given the fact that people have to go to the polls within the next couple of weeks? That's something that you guys be monitoring, especially to see if there's any impact from.
Absolutely. So the question is related to, with the election yesterday across the state, is there any concern that there may be a possible spike in cases based on potential exposure from so many people being out? In Eau Claire County, we worked very, very hard to make sure exposure was limited, and we do not have widespread community disease in this community. In other parts of the state, that is a bit different. We had many more people going to fewer sites for actual in-person election, and we have much more extensive community disease. Public health officials across the state this weekend did ask the governor and the legislature to not hold in-person election because of that. The trend data shows us that with that kind of congregate gathering of people, that there's a high likelihood that we will see an increase in the number of cases for COVID-19 following the election. Today it was announced by the state that a new field in our electronic reporting system will be, were you working at or going to the polls on the election day. So we will have data over time to know about that potential exposure down the road And that will be statewide data. That's definitely not specific to Eau Claire. And really the measures in place were really strong in this community. Any additional questions? Thanks so much for being here again today. We will be back tomorrow with an update, and we look forward to talking to everybody then. Thank you.